Welcome to our inaugural SUD Interdisciplinary Fellowship graduation. This is a recorded event as well as a live event. So anyone who can be with us today knows that they can also see the recorded event, and we will send everyone who is invited the link to the recorded event if they couldn't be here. I'd like to start off first with our Commissioner, Dr. Chinazo Cunningham, to say a few words of inspiration to the graduates.
Great. Thank you, Julia. And I'm really happy to be here this afternoon, joined by all of you to celebrate this graduation. So I'm Dr. Chinazo Cunningham, the Commissioner of OASAS. And today we really celebrate all of your hard work, your dedication, and your achievement in completing the fellowship program. You know, I'm really excited about this opportunity that we have to build a strong, diverse, and skilled workforce. This has been so much work, really in the making for everybody here. You all who completed the program, the educational partners, your mentors, and the staff at OASAS. And so it's really taken a whole village to make this happen, and it's just really exciting to be at this point. So, you know, the future of addiction is really exciting, and so you are the future for the field, and so I'm really proud of what you've been able to accomplish, and again, for your commitment to learning, to service, and to growth. So our mission at OASAS is to support a system of care that's grounded in equity, dignity, and respect, and so happy to have you all be a part of that. You know, this is just the beginning, and I encourage all of you to keep pushing forward and keep learning, and you know, to certainly to stay in this field and to bring your whole self to the field, because we really need all that you have to offer. As a physician who has practiced, you know, medicine and really worked with people with addiction for my entire career, over 25 years, I personally know it's challenging, but it's incredibly gratifying. I mean, to help people change and see their lives improve. I mean, there's just nothing like that. It's such a privilege. And so I'm just so happy to have you all join in this effort. So again, congratulations. And, you know, this is your moment, and I'm really honored to be able to celebrate it with you. So thank you.
Thank you so much, Dr. Cunningham. And our next speaker will be Dr. Aaron Fox, and he is the president of the New York Society on Addiction Medicine, who will also offer some words of guidance, advice, and inspiration.
Yeah, hi everybody. Thank you for the opportunity. It's nice to see everybody. Congratulations to all of the graduates. I believe there's some of the folks who trained with us at Einstein Montefiore, and I know you folks really bring a high level of expertise. So pursuing additional training and care for patients with substance use disorder on top of everything else that you already do really couldn't have been an easy task for you all, but your patients will thank you for your skill and compassion that you bring to the clinical care that you deliver in the future. So thank you for that. And it's really an honor for me to speak at this graduation. So I'd like to thank Doctors Cunningham and Mund and the other staff members at OASAS for the invitation. I'm at a conference now, the College of the Problem of Drug Dependence. So maybe some of you all will come and join us at this meeting that's run by the National Institute on Drug Abuse in the future. But I want to start with the punchline, which is that caring for patients with substance use disorder requires competence and compassion, just like any other area of medicine. And I know that these are among your accomplishments in this fellowship. So we follow evidence-based practice. We seek to engage and connect with our patients without coercion or judgment. We advocate for our patients within our healthcare system and society at large. But in this career path, how do we gain competence and protect our inherent sense of compassion? Siddhartha Mukherjee, the Pulitzer Prize-winning author of The Emperor of All Maladies and a medical oncologist, he had an article in the New Yorker this week about early cancer detection. But seeing his name in the byline reminded me about an article he wrote several years ago in the New York Times about his first experience caring for patients with opioid use disorder during his medical residency. The piece had the unfortunate headline, "A Doctor's Painful Struggle with an Opioid Addicted Patient." And Dr. Mukherjee's essay starts out with the phrase, "I once found myself entrapped by a patient as much as she felt entrapped by me." He goes on to describe their encounters as two pugilists circling each other, locked in battle over opioid painkillers. No trust, no care, only mutually assured destruction. So to be generous, his feelings of being overwhelmed and unprepared to care for patients with opioid use disorder are very common among physicians. But even decades later, in his reflections, he expressed uncertainty about what he could have done differently and whether there was anything that he could have done to reach that patient. He wrote, "We had no training in this kind of medicine. If the addict was helpless, then so too was the young physician." I think that doctors, like anyone else, are likely to feel frustration when they're asked to do a job that they're not well prepared to do. But I strongly contest that we're helpless when facing patients with substance use disorders. Hopefully, over the past year, you've learned that you're not helpless. You've sought out training. You've all learned advanced clinical skills. You've prepared yourself to care for people with substance use disorders. And sometimes this can be challenging, but it's also been one of the most rewarding parts of my career. So I want you to think back to what inspired you to pursue this OASAS training. What was it? For me, as a fourth-year medical student in 2003, I started working with Dr. Cunningham, and I had the opportunity to go on outreach with harm reduction agencies to single-room occupancy hotels that were being used as emergency housing for people with HIV. I remember my first time on outreach, the students were giving flu shots while harm reduction outreach workers was distributing supplies and making connections with the people who were living in the hotels. So I have very shaky hands. And as a naive 23-year-old student, I was also nervous to be in an SRO for my first time. So there was no way that I could hold my hands still to give the injection. Yet, like a dutiful medical student, I approached the first person and asked if they wanted a flu shot. So she grabbed the syringe out of my hand, gave it to herself, and said, "I can do this by myself." Of course, it was embarrassing for me, but it was also my first lesson in caring for people with substance use disorders. Respect autonomy. Our patients have skills and knowledge that in many ways exceed our own. So after this, I continued to go on outreach for years, and I learned about engagement and communication from the harm reduction workers that we were going out with. They approached people without judgment and provided them with hope. And of course, training with and working alongside Dr. Cunningham for so many years, I saw her extreme competence and tenacity. Our patients deserved the best possible care, and Dr. Cunningham was willing to push and shape and fight for a model of clinical care that made sense for our patients. That's what inspired me to practice addiction medicine, seeing that a dedicated team brought together experts from different disciplines to learn from each other and improve the care that we were providing. We were far from helpless. So I want to discuss with you all a few principles that I've learned from my harm reduction colleagues, which I think we can all apply within any clinical encounter. The first is humanism. What are we doing to protect the dignity of our patients? Second, pragmatism. My patient with lung cancer may not be ready to quit smoking, but they may be willing to switch to vaping or non-combustible nicotine product. Don't let the perfect be the enemy of the good in your career. Individualism. There isn't one treatment plan that will work for all patients. We need to explore our patient-specific treatment goals and values and then develop a care plan using shared decision-making. Number 4, autonomy. We respect patients' right to make decisions for themselves and honor their preferences for treatment. Even when people have severe addictions, they can still maintain capacity to make decisions for themselves. Number 5, incrementalism. One of my favorite phrases from the harm reduction community, which has been attributed to Dan Biggs from the Chicago Recovery Alliance, is any positive change. People get stuck within any behavioral change, but how do we coax them forward? I like to end encounters with patients by asking them, what's one positive thing that you can commit to doing for yourself over the next week? And finally, number 6, accountability without termination. This means that I take responsibility for my patients very seriously. If I'm prescribing buprenorphine, but my patient continues to struggle, I'm not going to turn my head the other way and ignore what's happening, but I still feel obligated to work with them, and I'm not going to fire them from my practice, so we need to discuss new options. Everyone deserves care, even if they're not following all of my recommendations precisely. So let me finish by congratulating you all and thanking you for taking the time to build competency in these clinical skills and remind you that compassion is an essential component of the care that you'll deliver. We're entering a political era where empathy has been questioned, cruelty towards the vulnerable has been normalized, and this will certainly impact our patients with substance use disorders. People in our field are now questioning whether we have become too permissive. They're encouraging us to embrace tough love and even advocating for greater stigma towards substance use. But I just can't see any positive role for shame in patient care. So I'll finish with one last story. For many years, I ran a group in primary care for patients who take buprenorphine, and a social worker and I would see 5 to 10 patients at the same time. At group, we'd discuss recovery skills, and we'd meditate, and we'd eat pizza, and then I'd write prescriptions for everybody after the group. The other doctors at the clinic tended to send us patients who continued to use non-prescribed opioids despite receiving buprenorphine treatment. So at one point, I asked the group, what do you think we should be doing if people keep using when they're coming to group? And of course, one person in the group said, well, if they keep using, they don't want to be clean, we should kick them out of group. And so we discussed that as a group, what's likely to happen if I stop prescribing buprenorphine to them. And we all came to the same conclusion. They'd start using other opioids more and possibly increase the risk of overdose. So we went around to everyone in the group and discussed the topic a little bit more. One of my patients, who's a woman in her 60s who'd lost a lot in her lifetime, said something that really stuck with me. She said, Dr. Fox, don't give up on us. We'll get there. So I hope when you move on to the rest of your career, you really take those words with you. Some of our patients will continue to struggle, but don't give up. What they need is hope.
I'd like to give Dr. Fox and Dr. Cunningham a round of applause for their inspirational words. My name is Julia Fesco. I am the Bureau Director for Workforce Development here at OASAS, and I will be your moderator for today. And I would like to now turn it over to Dean to bring up our presentation. Welcome again to our inaugural Interdisciplinary Substance Use Disorder Fellowship Program. The Interdisciplinary Substance Use Disorder Fellowship Program was hosted by 4 medical schools from around the state. There were 2 upstate and 2 downstate, and then 2 in New York City, and 1 in Buffalo and 1 in Syracuse. And this was an opportunity for schools which had addiction medicine fellowships or addiction psychiatry fellowships to add additional multidisciplinary staff to their fellowship experience. So individuals that work within OASAS's continuum of services could be trained in an interdisciplinary team, both in the classroom, online, and at clinical rotation sites. The goal of this program was to have fellows learn from each other and prepare fellows to work in OASAS's multidisciplinary teams if they so chose. The clinical rotation sites for each medical school are as follows. At Albert Einstein College of Medicine, you can see the clinical rotation sites were from inpatient centers to bridge clinics to wellness centers, primary care centers, pain clinics, buprenorphine treatment programs, and OASAS addiction treatment programs. At NYU Grossman School of Medicine, there were hospital-based settings, family health centers, federal qualified health center, and within the hospitals were different OASAS treatment settings. At University of Buffalo Jacobs School of Medicine and Biomedical Science, there were OASAS clinics. There were outpatient treatment program clinics that predominantly treat opioid use disorder with medications. Erie County Medical Center, an inpatient setting, and a criminal justice setting. Continued settings were outpatient clinics, the Veterans Health Administration, one of our addiction treatment centers, palliative care, and a children's hospital. At Upstate Medical University, there was SUNY Upstate Medical University Hospital, an inpatient setting, Krause Health, which is a OASAS certified SUD treatment setting with many different levels of care, from inpatient to outpatient to an outpatient treatment program for opioid use disorder and with medications, and Helio Health, very similar to Krause Health, and Farnham Family Services, which is a more rural, smaller city program. And now to recognize our interdisciplinary SUD fellowship graduates by medical school in alphabetical order. Albert Einstein College of Medicine. First, we recognize the faculty and staff that made this possible, Dr. Christine Torres Lockhart and Dr. Tiffany Liu. Additional faculty and staff, Kiera Laura, Dr. Matthew Holm, and Dr. Natalie Buslach. Also, faculty and staff, Dr. Rushi Shah and Vilma Vargas, Maribel Martinez, and Juanita Sanchez. And now our graduate recognition. Dr. Megan Brayman. Dr. David Edelman. Dr. Min Ju Kim. Dr. Rebecca Lichton. Dr. Lily Rabineau. Dr. Christopher Vo. And graduates, camera shy and not pictured, Dr. Michelle Bonera Dr. Musab Khan, Dr. Rachel Clark, Dr. Mustafa El-Hakim, Dr. Hannah Epstein, Dr. Philip McFarlane, Dr. Dolly Patel, Dr. Davi Ran, Dr. Hamza Sadra, Dr. Bresni Tejada, Dr. Nicole Totoro, Dr. Michelle Williamson, Samuel Wu, Dr. Maria Young, and Dr. Sher Wei Stephanie Yan. This program identified both primary care physicians and physicians from other specialty groups, as well as students, to participate in their addiction medicine program. And now the NYU Grossman School of Medicine. Faculty and staff recognition, Dr. Joshua Lee and Talia Rosen. And now our graduate recognition.
Evie Arasamwan.
Catherine Bernardo. Andrew Carey. Carissa Sasena. Zaldine Diamond. Cheyenne Glasgow. Tulia Griffiths. Kai Hers. Jennifer Ihadi Hoa.
Laura Jaramillo.
Michelle Jeffers.
Haza E. Camara.
Haruka Kukaz. Laura Liebers. Mira Nair. Kevin Peoples. Ronald K. Reed. Shauna Rose. Ashton Santo. Sherry San Juan. Shavonna Smith. James Swift. Maurice Williams. And our camera shy graduates, undergraduate scholars, Marilyn Mahoney, Virgil Min Perrier, Viviana Ortiz. Graduate scholars, Matthew Bretter, Kate Burke, Will Cerf, Peter Hardy, Sabrina Johnson, Raul Lorenzo, Kripa Mehta, Alina O'Connor, Natalie Panganelli, Denise Persad, Amber Saravia, Maria Lena Tejeda, Hakiva Salim, Justin Truglio, Ayaya Saidi, and as you can see, NYU added to their fellows, their current fellows, graduate and postgraduate scholars, and undergraduate scholars, undergraduate, graduate, and postgraduate scholars. University of Buffalo Jacobs School of Medicine and Biomedical Sciences. Faculty and staff, Dr. Frederick Elliott and Jennifer Carlson. Dr. Arthur Weissman and Dr. Linda Kahn. And our graduate recognition. Dr. Matthew Doyle. Dr. Aman Kachani. Rebecca Lip. Joshua Mora. And our camera shy graduates from year one, Michaela Logan, Madeline Kay, Dr. Aditya Varambali, Dr. Charles Wilbur. SUNY Upstate Medical University. Our faculty and staff recognition includes not only the faculty at Upstate, but also their clinical locations. Dr. Talani Ajabe. Dr. Zuzu Zambathin Mazeros. Dr. Kevin Johnson. Dr. Ross Sullivan. Dr. Habaniv Sharma. Dr. Amanda Ray. Thomas Springwood. Ingrid Hansen. Monica Taylor. Ashley Barone. Jennifer Dormio. Dr. Mario Magazino. And Shannon Peelman. Mark Raymond. Megan Pomeroy. And graduate recognition. Olayinka Awakoa. Maha Moses. Rosa M. Ramos. And our camera shy graduates, Candice Little Anderson, Chelsea K. Bittinger, Yvette Bischoff, Deborah Crummy, Dr. Lamoris Dexter II. Kimberly Keene, Dr. Deborah Mann. Rachel Parsons, Michael Rashetta, Kennedy Tarley. Congratulations to all the graduates and all your hard work. Graduation, a conclusion of one chapter, a beginning of another. Catherine Pulsiver. And to all the OASAS staff who've made this possible, I'd like to thank our executive team, our Workforce Development Bureau, and a special thanks to Sophia Favalis, who was the project manager for this program. And Cameron Burns, our administrative assistant, who was the coordinator of the graduation program. Also, our opioid settlement fund and substance abuse prevention treatment project management, who worked on this project. And our contracts, procurement, and purchasing department. Thank you all for joining us today for the inaugural SUD Interdisciplinary Fellowship graduation. We wish to continue to hear from you about your successes and even challenges. You can email us at workforce@oasas.ny.gov, and that's workforce@oasas.ny.gov. We'd love to hear about your successes and your challenges and any way we can support you in the future. And special thanks to Dean Hale, who was our slide operator and presentation coordinator. Thank you all for all your hard work. We wish you the best this summer and in your future endeavors. And thank you for your participation in this program.